Hello, everyone. Welcome to today's webinar. We will give another minute or two for everyone to join, and we'll be getting started momentarily. Thank you. Hello, everyone, and welcome to the CDC's Aquatic Health Goal Network webinar. My name is Daisy Galan. I'm a lead analyst at NACCHO, and it's a pleasure to be here. I'm joined today together with Rebecca Rainey, my colleague also at NACCHO will be the moderators of today's webinar. And we also have here today's speakers joining us. And it's a pleasure to be here, and we welcome everyone. In today's webinar, we'll be talking about creativity, compliance, and outreach in water safety with Columbus Public Health. You'll be hearing much more directly from Columbus, Ohio. But before we get started, just some logistics. This webinar is being recorded, and we will share a link to the recording together with a copy of the slides with everyone who registered for this webinar. So you should be looking forward to receiving that on your email in the next few days. Throughout the webinar, we encourage you to ask questions. We'd love to hear from you. We ask you to please use the Q&A box. You can access the Q&A box at the bottom of your screen. You can click on it. You can add your questions there. You can upvote 2 questions that you'd like to see given priority in our Q&A session at the end of the webinar. We should have plenty of time to answer everyone's questions at the end. So with that, a little bit about today's agenda before I pass it over to Rebecca. So we're going to start with some announcements from NACCHO and also from CDC. Then we'll move on to today's presentation from Columbus Public Health. And as I mentioned at the end, we're going to have plenty of time for questions and answers. So please keep track of your questions throughout this webinar, and we look forward to have a great and informative discussion at the end. So with that, I will pass it over to Rebecca, my colleague, to share some NACCHO announcements with all of you. Thank you.
Thanks, Daisy. Right, so we are very excited to highlight for those who are interested a brand new hot off the press report from NACCHO. This report is called Implementing the Model Aquatic Health Code at the Local Level of the Pueblo County Experience. So we had the privilege to partner with the Pueblo Department of Public Health and Environment in Colorado over the past year to capture their experience fully adopting and implementing the Model Aquatic Health Code into their local code. So this brand new publication is out documenting that experience, as well as sharing a complete timeline of all the steps that they went through to fully adopt and implement this report. To complement this, we also have a couple other resources from Pueblo County. We have a resource library containing resources that Pueblo County used during their adoption process. So this includes inspection reports, presentations, newsletters, and more. And we also have a webinar from July 2023 featuring speakers from Pueblo County talking about their experience. So you can click the link here once we send out the slides to access this report and the related resources, or you can visit NACCHO.org/MAC to view and download. Lastly, we wanted to re-highlight 2 of our Model Aquatic Health Code quick guides. These quick guides are on 2 topics covered in the Model Aquatic Health Code: splash pads and flotation tanks. And these are 2 to 3 page reference guides that can be used by health departments and pool operators as tools to understand CDC's key recommendations for operation and maintenance of splash pads and flotation tanks. So again, you can visit NACCHO.org/MAC to download. And if you're new to our MAHC Network webinar series, we really encourage you to check out our past webinars. We have 37 past webinars where you can view recordings and slides at NACCHO.org/MAC, as well as our YouTube playlist, which is linked here. And with that, I'm going to turn it over to Commander Joe Lako from CDC, who will be sharing some CDC updates.
Hey, thanks, Rebecca. You can forward to the next slide. Hi, everybody. This is Joe Lako. It's been a little bit since I've had an opportunity to speak with you guys in person. Kind of a regular on these webinars, working directly with Rebecca and Daisy at NACCHO on the MAHC Network. Couple announcements. Last week, we had Healthy and Safe Swimming Week at CDC. You may have seen quite a few media publications and articles in regards to healthy and safe swimming. This year's theme was prevent drowning, swim lessons save lives, and I think I even saw an article as recently as yesterday. Another feature that we were able to share with everybody this month was in collaboration with NACCHO, with Rebecca and Daisy. We put an article in the NEHA Journal of Environmental Health. So that's in the May issue under the CDC column. And Rebecca was able to put together a piece for us that showcased all of these tools that we have available on the MAHC Network. I wanted to focus a little bit of my time here very quickly where we're at with our fifth edition of the MAHC. The 4th edition, as you know, was issued just last year, about 15 months ago. We've already begun the process and are significant way through it for the next edition. So the MAHC document itself is managed by the Council for the Model Aquatic Health Code, CMAQ, and we work directly with them to receive change requests from the public, review those change requests one by one, which is probably the most tedious part of the whole process, but what gives us an opportunity to discuss their relevance, their importance, and whether or not they're going to be a good fit into the MAHC. And then we meet in person at the Vote on the Code conference, which is hosted by CMAQ. We did that this past February in conjunction with AOAP in Reno. And that gives us to have much more in-depth conversation, sometimes some passionate discussions about various change requests that were submitted. We also break out into various sectors and have caucuses. I was part of the Public Health Caucus, for example. That allows the presentation of all of the change requests that are then presented, not just there, but members for CMAQ membership have an opportunity to vote on every single change request. This year we received 202 total CRs. You could advance next slide, Rebecca. And of those, about 120 were approved by the voting membership and vetted by the CMAQ Board of Directors. Those were delivered to us at the end of April here at CDC. We had further discussions on each one of those and made final decisions and final approval on their inclusion in the 5th edition. And that's where we're at right now. So of the 202, 117 were approved as final for inclusion into the 5th edition, and 85 were not approved. We've fine-tuned all of those additions into the MAC, and all we're doing right now is cleaning up the appearance. It's a really whopper of a Word document, and it has a lot of formatting nuances with color and indents and font size, and it's very, very complex. So we have that with our expert right now, and she's going to finish that up this week. And we're going to put the code language document and the annex document both into CDC clearance next week. So I'm very excited to say we are well underway, and the clearance process is the last big hurdle. Unfortunately, the CDC clearance for documents that big will take 2 or 3 months. So our anticipated release is going to be February of next year. We're anticipating some hiccups and some things that we're allowed to do and not do towards the end of 2024. This is an election year. So between budgets getting approved or not getting approved and election results and inaugurations, we've decided we're going to wait till February 25. That'll give us a little bit of a 2-year gap between the 4th and 5th editions anyway, and get us a little bit back on schedule. We got a little bit behind on publishing that 4th one because COVID kept us all a little bit busy. That's all I had for CDC updates. Here's my contact information. I haven't shared this with you in a while. Feel free to contact me at any time. Rebecca, I'll swing it back over to you.
Thank you so much for those updates, Joe. All right, so with that, it is my pleasure to introduce today's speaker, who will be joining us from Columbus Public Health. So Austin Sprayberry is the public program manager at Columbus Public Health in Ohio. He has been working for Columbus Public Health since August of 2020. He started in the food protection program, and since December of 2022, he has been a program manager for CPSC's Pool Safely grant. So Austin, I'm gonna stop sharing my screen and let you hop on. Thanks, everyone.
Thank you, Rebecca. Everyone able to see that? Wonderful. Well, I want to just first thank everyone for joining today. Thank you to Becca and Daisy and NACCHO for having me. As Rebecca said, my name is Austin Sprayberry. I am the program manager over our Pool Safely grant, and I just wanted to give a little bit more background on where I came from. So when I first started my adult life careers, I thought that I wanted to be in a more clinical setting. So for those of you that aren't around Columbus, I worked in the hospital setting, one of the more major hospital streams here in Columbus for about 9 years, 2 as a nurse's aide and 1 as an operating room assistant down in the OR. And I thought I wanted to be a physician assistant. While I was, doing the physician or the operating room assistant programming, I figured that I wanted to go back to school, start taking those classes. And some of the classes that I was able to take were public health classes. And in one of those first classes, there was such a clear example of what public health was. And they said, public health is when you are sitting on the side of a bay and you see someone start drowning and you jump in and save them. That's the more clinical side of things. There's an immediate need and we want to take care of that issue. But then someone else is drowning and you have to save them, and someone else is drowning and you have to save them. And public health wants to actually look upstream and say, okay, where are all these people drowning from? What is actually going on with them? How do we stop that issue? And if we see that someone is just throwing people into the stream, we want to take care of that person and get the other people the resources they need. And so I think it's actually kind of ironic that I ended up here in essentially water safety and drowning prevention, since that was the example that really motivated me. So like Rebecca had said, I graduated from Ohio State, got a job with Columbus Public Health where I started in the food protection program doing food inspections in August of 2020, which was on one hand a pretty difficult time to transition into the job force. I'm sure that We don't need to talk about a lot of reasons why, but we can also be assured that there was a lot of job security. So while I was working in food, I was able to find cockroaches high and low. I'm about 6'6", so even the ones on top of door frames like that didn't really stop me. As you can tell, this is a facility where we didn't even really want to put our bags down. But I did the food protection program for about 2 years. I was cross-trained in other areas like vector, our water and land protection, and our healthy homes division that deals a lot with lead. And then in the last year, I passed my REHS exam, and then I applied to become the program manager over our pool safely grant that we have. Our direct team is not enormous, but we put a lot of good work in. It's my supervisor, Elizabeth Kirby, myself, and then we have a handful of rotating outreach workers. We get additional support from all of our inspectors, our REHSs and EHSITs at Columbus Public Health, and we're super appreciative for the help that they offer as well. So it was interesting coming into this grant and learning a lot more in depth about drain covers. I was always a swimmer when I grew up, and I did swim team in high school. And I remember even as a kid going to the public pool, swimming down to the bottom of the drain and feeling some of the suction that was actually on them. It was fun. And as a kid, it was interesting. And now doing what I do, I know that that was such a bad idea. For those of you that might be unaware, Pool Safely is a federally funded program that deals with drain cover compliance. It came into effect because in 2002, there was this little girl that you see on screen. Her name is Virginia Graham Baker. She was sucked down to the bottom of a drain cover of a spa, and she was in Virginia when she drowned. Sadly, the suction on it was so much so that she was actually disemboweled in the process, and the force on it was so great that 2 full-grown men couldn't lift her off. It was estimated that the force in that spa was about 800 pounds of pressure. So unfortunately for her, but fortunately for the future lives of other people, pool goers, pool and spa industry people, her grandfather was James Baker, and he was the former Secretary of State from 1989 to 1992 under the Bush administration. When she drowned in 2002, he was still heavily involved in politics, and he lobbied for about 5 years to bring about the Pool and Spa Safety Act, better known as the VGB Act that we have today. This act made it so that all pools needed to have suction entrapment proof drain covers with secondary methods of anti-entrapment like SVRS systems, multiple drains, or just unblockable drain covers. And so fast forward to a year and a half ago, Columbus Public Health received the Pool Safely grant from the Consumer Product Safety Commission for the second time. The first time we had it was right in the middle of 2020, and I have a feeling that I don't need to tell this crowd how difficult it is to do outreach when you can't actually be around people and get to interact with them. So I was going to share this video. There's some audio difficulties, but you can look this video up later if you really want it. We can exchange emails about it. But this little girl was Abigail Taylor. After the VGB Act came out, she was actually stuck down to the bottom of a drain at a country club that really highlighted just all the multiple steps of failures that can go wrong. The drain was never replaced. They just kept putting different screws into it. The drain cover was not intact. It was in disrepair, and unfortunately, she sat on it and drowned as well. And so we aren't going to look at that, but I wanted to bring this up in the first place because this is a really important thing, and I think it highlights why we do what we do. Sometimes it can be monotonous going into facilities, but we really need to make sure that we're up on that compliance, understanding where drain covers are. Do we understand the life cycle? And so because of that, Pool Safely Grant is highly concerned with drain covers. And so we're going to spend the rest of our time going over some of them. This is one of the most common ones that you'd see around at least Columbus today. It's the Hayward 1048. As you can see on the specs there, it has a max flow of 125 on the floor, 72 gallons per minute if it's used on the wall. It's supposed to be used with 2 covers since they're under the required size for it to be anti-trapment and proof. This one is another one. It's the Aquastar 24 inch. It's got 4, there's 12 covers. Max flow, guys, I'm just kidding. We're not going to spend the next 30 minutes talking about drain covers. That would be a really good way to never be invited to speak again and just have all of you sign off early. But knowing drain covers is a big part of the job. There's so much more to it than that, though. And by evaluating the issues that we are finding in Columbus in particular, but also you guys look at this critically with your own communities in mind, hopefully you'll be able to see that there are a lot of room that you can have for creativity and solving issues that you're going to see. I'll have my contact info at the end, so if anyone wants to reach out to me personally to get a list like this of approved drain covers, feel free to email me and I'll be able to get all of those to you. So this is Columbus Public Health jurisdiction. I'm going to walk you guys through our experience and the different opportunities that we had for creative thinking that came up when we were working our way through this grant. As a quick caveat, I understand that not everyone is going to have funds available for this to be someone's full-time position, but as I'm going through this, I would really urge you to try and think if there are even little things that you can start to do to incorporate into your work that can actually have a big impact for your department. So the first thing that we had to do was to get a scope of the issues that we were facing. Where were the drowning hazards? Where are the big risks in Columbus? And so the grant has to deal with drain cover compliance, but we wanted to leave room for that education piece as well. We believe that at the core of education component, our main objective is mitigating risks where we can and helping to prevent the drownings that are happening around Columbus. And so here in the Columbus Public Health jurisdiction, we have about 800 commercially licensed pools and spas. We can keep an inventory sheet in our inspection and report software called Envision, but sadly, we were still missing about 200 pieces of information at the start of this grant. And so part of this is that the drain covers aren't actually something that's on the inventory checklist. It's way towards the bottom and it wasn't a necessary component of information. And so that is largely concerned, the inventory checklist is with what's actually in the pump room, right? But we had some outreach workers. Here they are, a couple of them, Bobby and Madeline. Our first outreach workers and we had just started working through that big list that we had of missing facilities. On the screen, you see both of them, and I had just given them the full pool and spa safety spiel. We were doing compliance checks, and this was actually at the third pool that we went to. Madeline was checking it with the shepherd's crook and just, shoved it, and it came right off the rip. You see that they weren't doing a good job of maintaining that in good repair. But they just both looked at me and they said, oh, this is actually real. You weren't kidding. Things like this still happen. And I said, welcome to public health. The interesting things that if we're doing our jobs right, we tend to fly under the radar. But the info that we like to compile with our facilities is the make and the model when it was installed, because that ultimately tells us when it's expired. Depending on the manufacturers, different covers have different lifespans. Some of them are good for 5 years, some are good for 7, some are good for 25. There's just such a wide variety. And so the installation date is important, but so that we know when they need to actually be replaced. I'm not sure if we have any pool operators on the call with us today, but in an ideal world, we would like them to maintain what's known as the certificates of compliance. This is a piece of paper that comes with the make and model, and ideally that install date of pretty much every drain cover that's sold. My experience has largely been that when you ask people for this, they just give you kind of a blank stare, like you just asked them for $1 million while growing a second head. But I started carrying around like laminated copies of what they could typically look like. And every now and then people are like, oh, that's right. I do know where that is. And so understanding how to kind of bridge that gap in their knowledge could be helpful for people. There tends to be a lot of confusion, but we're able to get them for a lot of people as well. And so, as I said, I have a pretty comprehensive list of all the VGB compliant drain covers. So if we can see what is in the bottom of the pool, and that's a big if on the can, then we can have a pretty good idea of figuring out what they actually have down there. So this brought up one of our first opportunities for creativity. How many of you have ever showed up at a pool and there were just a ton of people in it? The water was super choppy, and we know that we need to look at the drain covers, but in your mind, at least, you might say, "I'll check that next time. I'll double check." I've done that. We don't want to be a total interruption to people's fun, but it can be a hindrance, right? How many of you have ever showed up at a pool and you can't even see the bottom when it looks something like this? There is just no way that you're going to see what they actually have in the bottom of the pool during that inspection. And I knew that I wanted to be able to see the drain covers, even in situations like this, which are all photos that I have taken personally, by the way. And so when we go out for these inspections, we want to be able to see the drains, because ultimately that's going to save us time on follow-ups, right? Time is money is what they say. Even if they don't have their certificates of compliance or know when they were installed, then we can at least get the conversation rolling on what they have in the bottom of their pool so that they can buy new ones and get them up to date. So after looking into cameras setups for entirely too long, I want to share some of my findings with you guys to help save you some time if you're going to think about your own setup. From the last time that Columbus Public Health had this grant, we were able to purchase some GoPro-like cameras. They weren't name brand or anything, but it was the same similar setup. We tried just hitting record on them, attaching them to this telescoping pole, scoping out where we thought it was on the cover. What we learned is that it's actually really difficult to maneuver. The camera was never at the right angle that you needed it to be. You had to take it out of the casing, hit record, put it back in the casing, try again, make sure that you were able to observe all the screws, that it was in proper repair, that nothing was sliding out of place, that they didn't pilot their own screw holes. We've seen that sometimes. And then what my boss and I did, Kirby, is that we timed it just for a spa, something close to the surface, not a 10 to 20 foot pool. And an attempt like this could easily take anywhere from 15 to 20, 25 minutes without guaranteed results. If you're in a supervisor position, how many of your inspectors would look at you and say, "You want me to take an extra 15 to 25 minutes to just check out a drain cover?" We knew that if we wanted this to be able to go out to more people, it needed to be a more accessible piece of technology. And so we would go figure out how we could do this a little bit better. In long term, the GoPro maneuvering, we'll call it, was not a very helpful idea. And so we said, okay, we need to be able to live stream it then so that we can at least tell where we're supposed to be aiming the camera in the first place. And so it had to be fast. So I searched for a lot of apps that would pair with our existing camera setup. I was trialing them for hours. I would just, as a word of caution to people, there can be a lot of sketchy apps out there, so just be careful. Don't download something if it looks like it's not reputable, if it has a lot of typos. I wouldn't necessarily recommend it, so I steered clear of those. But we were able to find one eventually, and it was working like a dream. I was probably very annoying to some of my coworkers because as they were trying to work in their cubicles, suddenly a camera would come out from the top and they would just see it staring down, and I'd say, "Wow, what a cool thing." So I called my supervisor, Kirby, immediately, and I said, "I've done it. I'm your bestest, smartest, tallest employee here, and I've solved the issue. Now we can live stream it." She was very excited, and we immediately went out to a facility. We got it all set up. We put her in the water, and what do you guys think happened? The camera cut out immediately. We tried a few more times because at this point we're scientists. We're testing a hypothesis, saying, okay, where did this come from? We came to the conclusion eventually that I don't know that much about technology is really what it came down to. This obviously wouldn't work because it transmits via Bluetooth, which are relying on radio waves, which is, I'm sure a lot of people already knew. Those don't transmit very well underwater. And so it would go down for about an inch and then totally cut out. I was really frustrated. I was back at square one, but I kept working on the issue, creativity. Right? I knew that the live feed was the way to go, but it had to be something through a direct connection. And so I had to do some more research and come up with an elegant, not so elegant solution, which is this. This is what I've dubbed the Drain Find-O-Matic 3000. If we have any anglers in here, you might say, Austin, that looks like you put a fishing camera on a fishing pole. And I would say, that is exactly what I did. Do you guys remember those pools where couldn't see an inch below the surface of the water? Well, if you're able to see that on your screen, we're actually able to zoom in and see what was actually happening under the water. Essentially, this is a fish finder camera on a telescoping fishing pole, so we can get out to the depth that we need to, and it has about 45 feet of line on it. And so at the very least, we were now able to verify that this pool did not have an imminent health hazard, that we could actually observe that the drain cover was intact, that no one was going to get stuck to the bottom and no one was going to be able to see them while they were down. And so when I first showed this concept to Kirby, she looked at me dead in the eyes and she said, "You want government officials, health inspectors, to show up to swimming pools with fishing poles?" And I said, "I absolutely do." We agreed that I could get one and I would start to test this theory. And if it failed, then I would take the hit on it. But I just want to say that I was personally so grateful for a supervisor that trusted me enough to do something that was a little more unconventional that has ended up yielding some phenomenal results. When all our cameras finally came in, one of our inspectors said, "Well, why do you need to do that? If it's murky and you can't actually see the bottom of the pool, it's an immediate closure item anyways. And so we're going to close them no matter what." And I said that you're absolutely right. For those of you that might be different jurisdictions, within our own Columbus City Health Code, we have an authority to immediately close a pool if it is an imminent health risk, like not being able to see the drain cover. But I said to them, well, think about it like this. We found that when it comes to building rapport with operators, it's actually a lot better to let them know up front all of the items that need to be rectified before they can actually be reopened. And there is nothing worse than someone who has spent all of their time fixing their water chemistry, getting back to everything clear, it's all in line, they're eager to open, only for you to tell them, actually, we need to wait a couple more days or weeks until you can get this thing in good repair, especially if that's in the middle of peak pool season. So knowing all of the info up front and clearly communicating it to our operators helps them know what they need to do, and you not to waste your time going out there to reopen them when they can't actually be opened. For those of you that are curious about this camera setup, there are a lot of really expensive options out there, but in totality, this camera setup costs about $140 altogether. The rod is purchased separately from the camera. It's affordable. If you're a supervisor here, do you have that in the budget? The camera has a light on it as well. And so you can actually go out 8 feet from the pool deck. And then, like I said, it drops down to about 45 feet, which has gone to the deepest pool, I believe in Ohio, which is the Ohio State dive. What you can see in one of the middle pictures there is that this is actually a nice enough camera that you can read some of the text that is on the drain covers, which can be helpful when determining what is actually in the bottom of the pool. So what about the certificates of compliance? As I said before, this is an issue that we came across with the operators, not being able to keep track of them. And so what I will do is say, okay, if we can verify what's in there, as long as you can show me a work order or a purchase receipt for when you got these these drain covers, then I can typically track down their certificate of compliance. But they need to be able to install, or they need to be able to produce one of those invoices or installation dates so that we can actually go by that. If they can't, then we tell them that they need to get new drain covers. People see that we've tried to work with them, and they're generally pretty compliant at that. In another creative avenue, I also asked Stephen, this genius of ours, when it comes to working with our report software and vision, to add an expiration date to the inventory checklist where people can actually input their drain cover info. And so now what we'll start to do in next year is that we can pull that list of who's going to be expiring at the end of the season and be able to more proactively reach out to our operators and say, hey, you might want to think about updating this because it's about to expire. So what do we do now, right? This is a glimpse of some of the work that we do with enforcement when it comes to our commercially licensed pools. But what else is there? As I said earlier, we aren't just looking for more ways to check boxes. We're actually trying to impact the health of the people that we serve by hopefully preventing drownings that are happening in the greater Columbus area. And at the start of the grant, we knew that we also needed to consider the non-commercial pool in our jurisdiction as well. This again presented more opportunities for creativity. We sought to really tackle the issue at hand by asking a handful of questions. One is, who is being impacted most by the drownings and the water rescues around us? When are they happening? What time of year? Where are they happening? Both in town, but also what kind of bodies of water are people typically drowning in? How prevalent is it? What are the issues? And then why are people still drowning? This is something that when you think about it, it should be solved, right? Is it a lack of materials? Is it a lack of skills? Do they need more education? Do they need more resources? What is it? And lastly, what can we do about it? And so we put these questions to our EPI team and we said, we need some real data, please. And they were complete rock stars. Here are some of the answers that we were able to get from them. So when it came to when is this happening, it's all year. Primarily concentrated in the spring and summer months, which we would come to expect. But there are also weird spikes at other times too. Late fall, middle of winter, where people trying to ice skate, what's happening? Who is impacted most? It affects everyone. That's what we learned. It's most concentrated points were in some of our lower socioeconomic neighborhoods, but some of the hot spots were also in our fairly affluent sides of town as well. And this kind of puzzled us until we saw where people were drowning. Largely, people aren't drowning in commercially licensed facilities, is what we found. Largely, the drownings and water rescues occur in retention ponds or just decorative ponds, open bodies of water like rivers that we have around here. Some of you might be in places that have oceans. Maybe there are a couple in residential apartments, but not a ton. It's prevalent. As you can see from this news article, Ohio tends to like to be best at everything that we can be. And if you were to just Google Ohio drowning rates compared to other states, for us being a largely landlocked state, we are not doing well. We have surprisingly high rates for how little open bodies of water we have. So let's look at why. If you look at most of the data out there, there seem to be the same recurring preventative measures that come up. People need to learn to swim. Drowning is the highest fatality rate for children 1 to 4. And did you know that formal swimming lessons can actually reduce drowning rates by 88% of the children in that 1 to 4 range? That stat is from stopdrowning.org. People need to learn life-saving skills, even just floating, survival swimming for toddlers, learning CPR for parents, older siblings, or caregivers. There need to be protected barriers around pools and those bodies of water, which makes sense. If kids can't get in the pool, then they don't drown in the pool. That's public health 101. Let's mitigate the risk. Prevention at the highest point. We ask people not swim alone. People staying vigilant. Be a water watcher is what we call it with Pool Safely. I've heard of countless stories of parents bringing their kids to the pool, tanning, falling asleep, scrolling their phone, never once looking at their kid. And especially for those open bodies of water, we want to have those life jackets. And so we looked at all of these and we said, well, what can we do about it? Without full details, because I think we're going to start running low, we went back to these 5 areas and we said, theoretically, if we can make an impact on these, then we'll make an impact on the drowning rates around us. And so number one for us was getting people a swim lesson. The odds are if someone knows how to swim in a pool, then they can swim in a pond or a river or a lake, whatever. So we got in touch with our community partners like the YMCA. Last year, we were able to sponsor 300 free swim lessons for people in our targeted communities. And this year, we're in the process of solidifying another contract to do the same. So we're really grateful for our community partners there. Myself, Elizabeth Kirby, and 2 of our friends in our strategic nursing team became CPR instructor certified and built into the grant to be able to give those swim lessons. It doesn't matter if it's just getting hands on a mannequin and showing people the proper depth and proper compression rate. Any little bit helps. We thought about it, and here are some of the ways that we can actually fight against drownings. We have the 311 system here in Columbus, which is if there's an active risk or a perceived risk even, people can call or go online to do the 311 hotline. Basically, residents and neighbors can file a complaint that something is a drowning risk, and I'll go out and investigate it. At the very least, we educate people at every house that we go to. We have a lot of informational handouts that we can give them. And we also bring a free door alarm for each of those complaints because kids sneak out of the pool every day, resulting in potential death. Last year in April of 2023, there was an NFL player, Shaquille Barrett of the Buccaneers, who tragically lost his 2-year-old because she snuck out of the back door and drowned in their backswing. So we do provide those door alarms. You can get them bulk on Amazon. They can tend to be pretty cheap price-wise, but they make a very loud noise. And so people can actually be alerted if their little ones are trying to sneak out back without them. We also set up an email line with people in the building and zoning and code enforcement. They tend to be out surveying the residential properties more than we do. And so if they notice a pool in a backyard with insufficient barriers, then they will actually send out an email to us and I'll follow up with the resident. We do these follow-ups and try and educate them before something tragic can happen as well. And so we're grateful for them sending information our way. And so in an effort to be more proactive than reactive, we also have, well, I guess I pull the permits that people file through building and zoning to build a new pool or spa or even modify one on their property. I do this once a quarter. I pull those permits and then I give them what I call welcome packets, which are essentially just something that we can deliver by hand, face to face with them. And the things that we typically have in these packets are things like just our pool safely swag. We have wristbands, we have pins, just little things for the kids, mini beach balls, pens, pencils. But then there are also things for the adults in there as well, like how to maintain your proper water chemistry. We still want to be proactive about any waterborne diseases that can come out too. And so balancing that chemistry, pulling parts from the CPO book, having people understand their chemistry is big, but also what are their barriers? You know, how are they maintaining them in good repair? If they have an above ground pool, doing the simple step and just taking the ladder out of the pool to help prevent drownings. The feedback that we've gotten from this has been awesome. The residents are really surprised that someone from the city is showing up and that they're giving out free things. It has the same door alarm in it. And it's just been another really good opportunity for us to build rapport with people in our community. Telling people not to swim alone. Nobody wants to think about a drowning and that it could happen to their loved one, but 1 in 10 people drown per day in the US. So this is obviously information that we need to get in people's hands because it's affecting some of our most vulnerable places. We need to inform people and educate the public on the very real possibility of drownings and how to prevent them so that people aren't just scared of the water, but they actually know what to do in the water. We also do a lot of tabling events, outreach events with people like the YMCA. We have Rise Up Sea Bus, which we kind of travel to all these different places around Columbus and make sure that people understand the resources that we have That's where we've been able to promote a lot of things like our swimming lessons. And so a question that I have just rhetorically for you to think about is, are there trusted names in your community and water management? And how can you partner with them to actually be able to distribute some information? You know, it's something that takes very little time. Are you able to pull permits and help people out in your area as well? This could be wearing life jackets, could be especially pertinent if you live in places that have a lot more open water, those rivers, lakes, oceans. We donated about 20 puddle jumpers to the YMCA so that they can have them for their guests, their patrons, and they can actually educate parents on what to buy. One of the worst things is having just the water wings, things that just go over the arms because kids will just slip right out of those. But there are also a good handful of life jacket grants out there. Some of them are not accessible to governments, but are you able to talk to your major pools or major operators, major facility people in your area and be able to get that information so that they can try and get some free life jackets for themselves? It's really just considering that you could spend 30 minutes to an hour, go meet with people, talk with people in the recreational space, talk to the residents that are getting things assembled, and how much could that proactively help people. And so, concluding thoughts here, like I said at the beginning, I understand that this is not something that everyone has the finances to do in totality. But from what we discussed here today, are there areas that you can actually focus in on? I know that in some of our more rural areas, lots of people have backyard pools. You know, are they permitted? Is there some way that you can actually stay informed on what's being put in? Are there areas that you can move towards those people? Are there partnerships that you can have with other agencies, even pool construction and maintenance? You know, if you're an inspector or a health commissioner on this call, can your department spare a few $100s to help better achieve compliance all at once? You know, can you help be a resource to the operators that are around you that are trying to do the right thing and maybe just don't have a full understanding of what needs to be done? Yeah, I think that those are some questions to think through. Here's my contact information. Again, if you want to reach out to me personally, I'd love to make those connections. But I think at this point, we can open it up for comments and questions if you'd like, Rebecca.
Great. Well, thank you so much, Austin. It's incredible to hear about the work that you have done in your team at Columbus Public Health. We want to encourage everyone to use their Q&A box to submit any questions for Austin. We do have some questions here that we would like to start off, Austin, and we'll keep an eye here in the Q&A box for other questions coming in. So, as you're going through this process, Austin, can you describe your interactions with the State Department of Health in Ohio and any other county or city health departments that you have engaged with through this process?
If engaged in what sense, I suppose? Although we occupy the majority of Franklin County, there's still a Franklin County Health Department, but we're kind of our own jurisdiction within that realm. And so when it comes to partnering with them, there are a couple other opportunities for us to go outside of our jurisdiction to some of the larger area codes that we have around where some of the people have drowned, that the pool that we want to table at isn't necessarily in our jurisdiction, but the people that are drowning are still in that zip code. And so I've gone to them and said, hey, we're not here to, you know, close your pool or anything. We would just really like to be a resource to your communities here as well. And at that point, people are generally receptive. Because of the work that we do, we kind of have to stay largely within our jurisdiction because this grant cycle required at least 51% of our time and everything to go to enforcement. And so those needed to be concentrated on our specific pools. But whoever asked that question, if you want to follow up more specifically on what the process is or clarify the other interactions, you can get my contact info, and I'd love to talk about it.
Thanks, Austin. And I just added your contact information to the Q&A box for anyone looking for it. We'll also send it out afterwards. So another
Thanks,
question we have, yeah, no problem. So another question we have is, what is the typical lifespan of a VGB compliant drain cover? How often do they need to be replaced by the operator?
Like I said, they can run anywhere from 5 to 7 to 10 to 25 years. Some of them, if they're stainless steel, can actually be a lifetime. Even with the lifetime ones and the drain covers that are longer, I want to say the stainless steel screws that are in place still have to be changed out every 7 years. And so that's one of the main things, is just making sure the equipment is all in repair. There are literally hundreds of different kinds of drain covers. I borrowed a list from our friends in Florida who had compiled a fairly comprehensive one. And so at the top of that, you'll see if they all have the pictures of what the drain covers are. Let me see. I can share something if you'd like. Sorry, took a couple clicks there. So these are the VGB approved drain covers. You can see that there's some more popular models out there, but some of them are only good for that 5 years. Some of them are good for 7. I would say the primary ones that we tend to see here in Columbus are Aquastars, Waterways, and Haywards are some of the most popular. There's also some Lawson, Neptune, Benson that are good for that 10 to 15 years. And then Paddock, which makes the stainless steel is lifetime, but then the screws, change every 7 years. But this is a really helpful table because it also has hyperlinks. So let's say you want to go down to a Hayward, there it is, and you'll be able to kind of compare the picture of what's in front of you here down to the bottom of the pool. And just to give a scope of reference, like I said, we've got all types of drain covers. And so I'm happy to share this document as a resource for whoever would like it. And thanks to our friends in Florida for providing that for everyone.
Yeah, thank you so much, Austin. Yes, if you can share that, we'll definitely include it with our materials in our follow-up email to everyone. Katie from North Carolina also shared their website here, has a resource. So thank you, Katie. We include that in our resource as well. So Austin, we got a question here in the Q&A. It's pretty specific, but I will ask it verbally. But if we need it, we can always follow up. We'll ask this question as well. So how do you determine whether a pool needs an SVRD or SVRS or any type of anti-entrapment device in addition to the VGBA certified covers, other than just the center, other than just the main drains that are 3 feet center to center apart? And this is a pre-1999 pool.
Yeah. So the SVRD, I'm a little less familiar with. Most of the pools in Columbus here have been relatively updated, and so we actually only have a handful of SVRS systems as well. But I would say that the SVRS definitely needs to be intact if they only have one drain at the bottom of the pool that is considered blockable, which at least according to our code is anything under 23 by 18. And so typically if someone has a 24 by 24 inch drain cover, then that's considered unblockable, but it needs to have some form of that kickback. I know that there's also a couple instances where there is a pool in Columbus that has a blockable drain, but it is a gravity fed that goes into a pit. And so it's not something that requires that SVRS because there's no real like suction that's happening on that drain, if that makes sense. I'm happy to continue that conversation as well if whoever submitted that would like to. But that would be my initial response.
I think we might have time for one more question, but if anyone has any other questions they want to submit, we can always follow up with Austin afterwards and get those answers out. So for our last question, we have, how many of the public aquatic facilities in Columbus have lifeguards on staff? And do you see less drownings at pools where lifeguards are present? Do you see more injuries and drownings at pools without bathers' supervision and surveillance?
So I would say that I don't have the numbers offhand, but kind of from the slides that we got from our FP team, it seems like the pools that have lifeguards tend to see less drownings. They might have more water rescues, but you can also look at that and say, well, they're having 10 times more the population head to them than maybe a neighborhood pool or an apartment complex pool or even someone's backyard pool. So I would say that there are probably more water rescues that happen in those, but not necessarily more drownings that happen off the rip. There are, I know, still things that happen. Last year we had a 3-year-old who had a water rescue at a commercially licensed pool in a hot tub in a spa. Shouldn't have been in there in the first place, but it was a big family reunion. People thought parents are watching, parents thought cousins are watching. So accidents can happen. That particular place didn't have a lifeguard at it, I don't believe, but the child was still able to be taken to Children's Hospital and I believe stabilized there. So, yeah.
Well, thank you so much, Austin. It's such a great conversation, and we appreciate your time for being here today. And like we said before, we share your contact information to everyone here as well. We want to thank everyone for joining today's webinar. Please feel free to reach out to us at NACCHO, Joe Lake at CDC, and Austin Columbus Public Health if you have any other questions. We'll follow up after this webinar in an email with the recording of this webinar, the slides, and some of the resources that were mentioned here on the call today. We hope everyone have a good summer. I know it's full season. That means a lot of us will be quite busy. So thank you, everyone. Stay safe. And we'll see you here for our next webinar, probably sometime in the fall. So have a great day. And this concludes today's webinar. Thank you, Austin, and thank you, Joe.
Thanks, y'all.